Hello, I'm Dr. Stan Yeatts, a board-certified obstetrician and gynecologist with Stork Advisor. Today, we're diving into an important topic that affects many women, Polycystic Ovarian Syndrome, or PCOS for short. If you're watching this video, you or someone you love may have symptoms that cause you to wonder about PCOS. Let's cover some basic information about this condition. I'd like to share my observations from experience with a lot of young women who have PCOS. Often I have met women who have had the symptoms of PCOS, but their healthcare provider possibly hasn't addressed their concerns. They don't feel that they're being heard. Nothing is done to evaluate or try to treat the symptoms. Often these women are frustrated in addition to the symptoms. The good news is this condition can improve in most cases. So what exactly is PCOS? It used to be called polycystic ovarian disease, but that label is no longer used. A disease can be life-threatening, but PCOS in itself is not life-threatening, but it can be life-changing. Now, in my view, PCOS is a hormonal imbalance that affects women of reproductive age. The cause is not known. A young woman normally has ovarian follicles at various stages of development, but when there are too many of the certain size of follicles, PCOS symptoms are possible. The numerous little cysts are making hormones as progesterone and estrogen, which leads to symptoms. I've noted that some women may have milder manifestation of PCOS symptoms than others. Now let's talk about common symptoms of PCOS. Menstrual problems are reported. Maybe periods are all over the place. Sometimes they come too often, sometimes not even at all. Another symptom is excess hair growth. About 7 out of 10 women with PCOS will have a male type of hair on the face or the abdomen. It's called hirsutism. We're not talking about peach fuzz on the face. Some families, for example, with Mediterranean origin, may also have a natural tendency of dark hair growth. Obesity is a common symptom. It can be a result of the insulin resistance that is common with PCOS. It's observed in about 80% of women with PCOS, which means that 20% of women with PCOS have normal weight. Commonly, PCOS can cause acne or oily skin, typically from the excessive progesterone. Mood changes are also a possible problem, resulting from hormonal imbalance. It can make women feel depressed or even agitated. A secondary symptom of obesity may be sleep disturbances. Now, what are causes and risk factors? No one really knows what causes PCOS. Insulin resistance is linked to PCOS and results in the weight gain. Women report difficulty losing weight despite their best efforts. High progesterone from the numerous ovarian cysts are metabolized into higher levels of male hormones called androgens. The androgens may change or suppress the menstrual cycle with possible increased hair growth. Ovulation may also be affected. Obesity and diabetes may be considered risk factors for PCOS, and actually, PCOS may lead to the development of diabetes and extra weight. Family history of PCOS is a risk factor. If your mom or sister has this condition, your chances may be higher too. Now, how about long-term complications? PCOS results in unpleasant symptoms. If left untreated, there can be long-term health problems related to PCOS. Lack of ovulation is common with hormonal imbalance can suppress ovulation, leading to difficulty conceiving. The insulin resistance can increase risks of type 2 diabetes and gestational diabetes, even cardiovascular disease. With obesity, abnormal uterine bleeding and endometrial thickening from the higher estrogen levels can be linked to other conditions. Now, how about diagnosis? Diagnosing PCOS isn't very straightforward. When I evaluate a young woman for PCOS, I want the following information. A detailed medical history and physical exam is important. A panel of blood work is also helpful. A complete blood count, a complete metabolic profile with liver function tests, lipid panel, and hemoglobin A1C are helpful. Thyroid function tests are important because thyroid disease can mimic PCOS symptoms. Also, hormonal levels of estrogen, progesterone, testosterone, and DHEAS, an androgen produced by the adrenal gland, is also important. Finally, a pelvic ultrasound can be very helpful. It provides an image of the pelvis with some anatomic details. Ultrasound alone is not considered sufficient to diagnose PCOS. However, if abnormal bleeding has been a problem, there is another reason for an ultrasound to consider uterine abnormalities such as uterine fibroids. Now, how about treatment? When it comes to treating PCOS, the approach depends a lot on current goals of the woman. For example, if she's actively trying to get pregnant, some therapy is not ideal. Options include lifestyle changes. Diet and exercise can work wonders. Symptoms can improve with just a simple weight loss of 5 to 10 pounds if the woman is overweight. The more she loses, the better the symptoms can be controlled. Now, how about medications? Birth control pills can help regulate the hormonal levels that can improve irregular menstrual cycles, hirsutism, acne, and mood problems. Insulin-resistant treatment is also used. For years, an oral medication known as metformin has been used for the insulin resistance. It does have potential side effects, but it is inexpensive since it's a generic medication and has moderate success for improving symptoms. Glucagon is a hormone produced in the intestinal tract and improves blood sugar control. Now, there are new medications called GLP-1 agonists, which are medications that can mimic the glucagon in the body. Some common brand names may be familiar to you from TV commercials like Trulicity, Wegovy, or Ozempic. They were developed for diabetes treatment. However, with widespread excitement, there's been coincidental weight loss. Specific PCOS treatment with these medications is not FDA approved. However, coincidental improvement of PCOS symptoms has been observed in women with type 2 diabetes treated with one of these medications. These medications are popular and unfortunately expensive. Past supply issues have been a result of their popularity, and it's also led to some counterfeit products finding their way into the market. Just be aware that they don't work for everyone. Dietary supplements have been used. Inositol has been reported to anecdotally improve PCOS symptoms, but fertility treatments may be important. If you're trying to get pregnant, oral contraceptives, of course, are not appropriate. Treatment of insulin resistance is acceptable if you're trying to get pregnant. There is validity, though, by reproductive medicine specialists. Surgery, in some cases, may be necessary. Laparoscopic procedures can be used using something called ovarian drilling technique that can improve symptoms by reducing the number of ovarian cysts that are present. That releases the high progesterone levels and helps to trigger ovulation with improved menstrual cycle regularity. Now, how about prevention? PCOS risk can be lowered by maintaining a healthy weight. Eat a balanced diet, especially low in refined carbs, white sugars and flour with minimal processed foods. Stay active with regular exercise. Get routine checkups with your women's health care provider. Now, to wrap things up, PCOS is a complex condition that affects many women in different ways. If you think that you might have PCOS, talk to your women's health care provider to get a personalized evaluation and advice. Diagnosis and possible treatment help to control symptoms as much as possible, which may provide a better quality of life. PCOS is a marathon, not a sprint. The long-term health problems may be avoided with proper intervention. While PCOS can feel overwhelming, there is hope. With the right intervention and support from loved ones and your healthcare team, you can feel better. Now, feel free to leave any additional questions in the comments section after this video. I'll address them in future videos. Don't forget to like, subscribe, share, and comment on this video to help spread awareness about PCOS. The journey can be challenging, but you are not alone. I'm Dr. Stan. Thanks for watching. At Stork Advisor, we want all your dreams to come true.